Hello and welcome to the Workplace Safety Training, addressing safe practices in clinical laboratory environment. In this module, our focus will be on quality control in clinical laboratories. The topics covered in this module are: what is lab data quality control, what leads to data inaccuracy in clinical laboratories, what quality control techniques are used for data integrity in clinical labs, what is an X/R control chart, how is clinical laboratory data analyzed and monitored, how to set upper control limit and lower control limit. Lab data quality control in a clinical laboratory encompasses rigorous procedures to ensure the accuracy and reliability of test results. It's critical for accurate diagnosis because precision data informs clinical decisions. Without it, patient care could be compromised by incorrect treatment decisions based on faulty lab results. Quality control safeguards against errors, ensuring that clinicians can trust the lab data they use to diagnose and treat patients effectively. Various factors contribute to data inaccuracy in clinical laboratories, including instrumentation errors, human error, reagent issues, inadequate training, environmental factors, sample integrity, testing procedure errors, and quality control failures. We'll briefly discuss each of these points. Instrumentation errors. Faulty, uncalibrated, or improperly maintained equipment can produce inaccurate results. Human errors such as mislabeling specimens, incorrect data entry, or improper handling of samples can all contribute to the generation of unreliable data in a clinical setting. Reagent issues. Using expired or contaminated reagents can skew test outcomes. Inadequate training. Laboratory personnel lacking sufficient training may perform tests incorrectly. Environmental factors. Temperature and humidity levels outside of specified ranges can affect specimen integrity. Sample integrity. Degraded, hemolyzed, or contaminated samples can produce inaccurate results. Testing procedure errors. Deviations from standard operating procedures can lead to variability. Quality control failures. Not having or not following stringent quality control measures can allow errors to go undetected. Techniques of ensuring data integrity in clinical laboratories through quality control include the following. Use of control samples. Control samples are tested in the same way as patient samples to validate the precision and accuracy of results. Repeated testing of control samples helps to confirm that results of patient samples are reliable. Internal quality control, in short IQC, which involves the use of control materials that are tested in the same way as patient samples to ensure the test system is working properly. External quality assessment, in short EQA, also known as proficiency testing. It requires testing of unknown samples sent by an external agency and comparing results with those from other laboratories. Standard operating procedures. Detailed written instructions to achieve uniformity in the performance of a specific function. Instrument calibration and preventive maintenance. Regularly scheduled calibration and maintenance of laboratory equipment to ensure it functions correctly. Training and competency evaluation. Ensuring that laboratory staff are adequately trained and regularly assessed for proficiency. Statistical process control. Use of statistical methods and control charts to monitor process performance and identify trends that may indicate potential problems. Document control. Managing documents to ensure they are reviewed, updated, and approved by authorized personnel. The X/R control chart is a vital statistical tool in clinical laboratories for monitoring and controlling processes. Here are key points along with examples of the use of X/R control chart in clinical laboratories. Monitoring process stability. It helps in assessing whether a process is stable over time by tracking the variation in sample means and ranges. As an example, if daily average blood sample hemoglobin measurements remain within control limits over a month, the process is stable. Identifying process variation. The chart distinguishes between common cause variation, which is inherent to the process, and special cause variation due to specific changes or anomalies. As an example, a certain spike in the range chart beyond the upper control limit could indicate a malfunctioning analyzer, a special cause variation needing investigation. Evaluation process adjustment. After implementing changes to a process, the X bar R chart can confirm if the adjustment lead to improvements. For example, after recalibrating an analyzer, subsequent plots show reduced variability, indicating the calibration was effective. Improving quality. Regular use ensures ongoing compliance with laboratory quality standards, reducing the likelihood of errors. As an example, continuous monitoring of complete blood count test results using X bar R charts helps maintain accuracy and precision, ensuring reliable patient diagnostics. Training and competency. The chart serves as a training tool, helping technicians understand process behavior and the impact of their actions. As an example, new technicians plot quality control data for electrolyte testing on X bar R charts, learning to recognize and address variations. Process comparison, which can be used to compare the performance of similar processes over time or between different equipment. As an example, comparing X bar R charts of two hematology analyzers over the same period can help identify which is performing more consistently within control limits. By integrating X bar R control charts into routine laboratory operations, technicians can proactively manage and improve the quality of testing processes, ultimately enhancing patient care outcomes. Evaluating and monitoring results in a clinical laboratory on a daily and monthly basis involves careful analysis of control data and the use of statistical metrics to ensure testing processes remain consistent and accurate. Here is how it can be done. Daily quality control checks. Review control data each day to confirm test results fall within expected control limits. Monthly data analysis. Aggregate control data monthly to observe larger trends that may not be apparent on a daily basis. Calculation of standard deviation, in short SD, and coefficient of variation, in short CV. Calculate the SG to measure the amount of variation or dispersion from the average control data. Determine the CV as a standardized measure of dispersion, useful for comparing variability regardless of unit of measure. Monitoring SD and CV fluctuation. Track changes in SD and CV over time. Stable SD and CV values are indicative of a stable process. Comparison of internal CV to reagent manufacturer CV. Compare the laboratory CV with the CV provided in the reagent or instruments manual or insert. Consistency between the lab's CV and the manufacturer's CV suggests the testing process is performing as expected. Take action based on variance. If there is significant variance between the lab's CV and the manufacturer's data, investigate potential causes. Actions may include recalibration of instruments and re-evaluation of reagents. By methodically reviewing and analyzing control data and taking corrective actions when necessary, laboratory personnel can maintain the integrity of the clinical testing process, which is crucial for accurate patient diagnosis and treatment. To set up upper control limit, in short UCL, and lower control limit, in short LCL, in a clinical laboratory. Manufacturer guidelines. Follow the control limits provided by the reagents manufacturer. They have predetermined UCL and LCL based on extensive validation studies. Historical lab data. Calculate UCL and LCL based on your lab's historical data by taking the mean of the control test results and adding or subtracting 3 times the standard deviation to get UCL and LCL. These steps help ensure that the lab's test results are accurate and reliable. Now, let's revisit and reinforce certain key components covered in the previous lessons to recall and solidify our understanding. aiding in the retention of our learnings. Biosafety refers to the set of principles, practices, and safety measures implemented to prevent accidental exposure or release of infectious agents, toxins, and other biological hazards in laboratory and research settings. It involves the use of specific protocols, safety equipment, training, and specially designed facilities to protect laboratory workers, the community, and the environment from potential risks associated with handling biological materials. The primary objective of biosafety is to ensure the safe and responsible management of biological substances to prevent the spread of infections and maintain the well-being of individuals and broader community. To establish comprehensive biosecurity measures, it is imperative to focus on key aspects including the proper disposal of infectious waste, securing blood and body fluid specimens, and the safe disposal of sharp items. Now, we'll delve into each of these crucial points, providing detailed insights to ensure a thorough understanding and effective implementation of biosecurity protocols in the laboratory. Healthcare personnel exposed to needles face an increased risk of needle stick injuries, which can lead to serious infections with bloodborne pathogens like hepatitis B, hepatitis C, or HIV. It's crucial to learn how to protect yourself and your colleagues from such injuries. Workers at risk include nursing staff, lab workers, doctors, and housekeepers. Needle stick injuries often occur due to unsafe practices such as improper needle handling or disposal, transferring fluid between containers, or not using safety engineered sharps. Preventing needle stick injuries involves minimizing unnecessary needle use, adopting safety devices, and promoting education on safe handling practices. Healthcare professionals can protect themselves by avoiding unnecessary needle use, using safe devices provided by their employer, and promptly disposing of used needles in designated containers. In case of a needle stick injury or exposure to bodily fluids, immediate action is necessary. Clean the affected area with soap and water. Flush any splashes to the nose, mouth, or skin with water, and irrigate eyes with a sterile solution. Report the incident to your supervisor and seek medical attention immediately. In clinical laboratory practice, the diligent application of quality control measures is the foundation that ensures the accuracy and reliability of test results, which are critical for patient diagnosis and continuous improvement of healthcare services. We'll come back soon with our upcoming sessions on workplace safety training series for safe practices in clinical environments. Stay tuned for valuable insights and practical tips to ensure a secure and productive work environment. Thank you.